Hi, I'm Naomi, and I am a student at Midwifery College of Utah. And this is my presentation on Prom, or premature rupture of membranes. And I'm going to discuss with you the options and some of the things to look out for. First off, what is Prom? Prom is when the membranes around the baby release before labor has started. So, if you think back to all of the movies you've ever seen, typically prom is what starts the labor. So, like in Sex of the City, I think it was Charlotte ran into Big, and of course, the stress from that caused her water to just rupture in front of the taxi cab. And I do believe the other movie where it happened was it's portrayed in the movies as like how every labor starts. My last client, actually, her husband was convinced that's how the labor would start, and of course, after I said probably not, that's how her labor started. So I was like, I jinxed it. Now I'm going to go over some of the risk factors. So some of the risk factors are smoking, having a sexually transmitted disease, like chlamydia, because it just eats away at that water bag. And a yeast infection, the same, it just breaks down that membrane. But most of the time, prom happens because of the normal weakening of the bag of water at the end of pregnancy. Anecdotally, many say that snowstorms, hurricanes, tornadic weather, or just any low pressure system can cause prom to happen more often. And then a definite old wives' tale is a full moon. The barometer or the pool of the moon will pull on that water bag just like it does the ocean. So I think there's some truth to it, and definitely with the storms, but I couldn't really find any studies on it, so I can't really say it's the truth. So anecdotally. Let's see how often it happens. So, prom is estimated to happen in 1 out of every 10 labors. And one of the last statistics I saw was 33% of labors start with prom. So it may be changing a little with updated research. Sorry, I'm coming off my Zyrtec, so everything itches. Let's see. Okay, so things to look out for, and I like to say, let's talk about it because the acronym is TACO. So the T is time. These are things that your provider is going to want you to write down. So, and the first thing they always ask you is, what time did your water break? And then the amount, like approximately how much fluid. Sometimes when the water breaks, it's a big gush, and other times it's just a trickle because that baby's head is so low, it's plugging the water's exit. The color, is it clear, honey colored, or green? To me, it looks a lot like straw colored, like Rapunzel. And odor, this is very important. Does it smell earthy or does it smell foul? To me, amniotic fluid, smells like birth, but prior to like being in many births, it smelled kind of like hay to me, like being in a barn that just got fresh hay. So that's just my opinion of how it smells, though. Now what? Okay, so what are your options? There are 2 ways that this is managed. Expectant management, which is definitely safe if you are GBS negative. GBS is something that is tested for routinely at hospital births. In my state, home births don't test for it unless the client requests it. We spend time giving them good probiotics and suggesting good probiotics to kind of reduce the risk of having GBS. But this is usually tested for at 35 weeks, and that's where they take a swab of your vagina and your rectum. But if you are GBS positive, there are higher risks to ask about, especially with infection and cervical checks. The other thing is 45% will go into labor by 12 hours, and 75% go into labor within 24 hours. And then I didn't post a statistic, but 92% went into labor within 72 hours. And some ways to encourage labor. Nipple stimulation. So either hand expressing your colostrum or using your breast pump. Castor oil, but always consult your provider about this, because there are some risks to castor oil. Sometimes it can hyperstimulate. Nipple stimulation can as well. Acupuncture, not only is it relaxing, but it really helps open up those channels. And then spicy foods, anything that irritates the digestive tract seems to also irritate the uterus. And then active management. So studies did kind of point to active management as the way to go, because of the risk of infection. But they also didn't separate cervical checks versus non-cervical checks as far as overall risk. So I think that personally, I think that the higher risk of infection may be related to the cervical checks. And there were studies saying, 2 cervical checks increases your risk by 25%, but then you get like 6, and it's like going up to like 30 to 40%. So if you avoid cervical checks. The ways that they can do this is Pitocin. Pitocin is a synthetic form of oxytocin used to induce labor. But keep in mind that Pitocin does not cross the blood-brain barrier. So when you're being induced with Pitocin, you're not getting those natural pain relievers from your body. So it can be a lot more difficult to handle. Prostaglandins is a drug used to promote uterine contractions. It's usually put by the cervix. And there are some risks with that because it's being introduced into the vagina. And then Cytotec is usually taken orally. It's another drug used to induce labor. It's actually an ulcer drug, but they found out it caused uterine stimulation. And then induction leads to shorter time in the hospital setting and decreased risk of maternal infections. Things to think about is like, what is the most important risk to you that you're trying to avoid? Like, is it C-section or an epidural? And what is the most important benefit? And who is helping you make this decision? Also, keep in mind, what does your intuition say? And do you understand the risks and benefits of each decision? The brand acronym is benefits, risks, your alternatives, and what if you do nothing, and then your decision. Hopefully it's not jumpy because my kids keep butting in. So these are the resources, but my favorite one is the Evidence-Based Birth podcast. Usually I just Google the Premature Rupture of Membranes Evidence-Based Birth podcast, and you can find the episode that way. If you're an auditory learner like me, it's really helpful because you can pause and rewind and kind of go listen to the parts that are important to you over and over again. So I am done with this. The most common questions I say I would get is, what can I do to get labor going? And so, like I said, the nipple stimulation, the acupuncture has been amazing. We have a great acupuncturist in my area, and she is really good at getting moms into labor. I think it's just the relaxation and being able to drift off and then opening all those channels. So, but, yep, I hope everybody has a great day.